Hello, I'm Nicholas Cohen, a family doctor, and I'm here to share with you a top 10 list of tips to identify and manage colic. The first tip is knowing how to identify colic. Colic is very common. It happens in 1 out of every 5 infants, or 20% of children of babies. It's crying that won't stop. You may try to change your baby's diapers, to feed your baby, to hold her, and it will seem like nothing you can do can make your baby stop crying. Your baby may draw up her legs, she may pass gas, you may even feel that her stomach is a little bit enlarged, and she may appear hungry but refuse to eat. This can last at its most up to 3 hours a day. Usually starts at about 2 weeks of life, and it's usually over by 4 months of life. Tip number 2, if you suspect your baby has colic, it really is important to check with your baby's doctor, just to make sure that it is just colic and not a serious medical problem. Your baby's doctor will check your baby's history, will measure your baby's growth, and do a physical exam to make sure there aren't things like hair tourniquets, which is where hair is tied around a part of the body and it's hard to see, but it can cause babies to be irritable, or a corneal abrasion, which is a scratch in the eye. These things can be found on physical exam, and it's a good thing to just have your child's doctor examine your child and get a good history and growth before you assume it's colic. Tip number 3 is good vibrations. Actually, if you can give your baby a ride in a car, or put your baby in the stroller and take her for a walk, or hold her and rock her, all of these things have been shown to decrease irritability in babies with colic. It's important, though, in finding a place with some vibrations, not to put your baby on a clothes dryer. There have been accidents of babies falling off clothes dryers before. Tip number 4 is white noise. White noise, which is any kind of noise that creates a calming sound, may help your baby fall asleep and can be a good treatment for colic. You can run a vacuum in the room next to your baby. You can place your baby near the clothes dryer with the clothes dryer on, which has that sound that is soothing. You could turn on a fan or use a white noise machine. Tip number 5 is to try a pacifier. Pacifier can be helpful mostly in babies who have already been using a pacifier before and are comfortable with it. Pacifier has worked for babies who have colic. Tip number 6 is try putting your babies on your knees with her stomach down on your knees, and gently rub her back. This pressure against her belly can actually comfort her. It's always important, though, that when you're putting your baby to sleep, that you put your baby back to sleep with the stomach up and the back on the bed. Swaddling is another effective measure, where you wrap your baby up in a large, thin blanket. This can make your baby feel secure and warm and can be a good treatment for colic. Tip number 8 is diet changes. Sometimes colic is actually due to food sensitivity. If you're breastfeeding your baby, and it's recommended that you breastfeed your baby, really that you breastfeed all babies up until 4 months of life with only breast milk, or even 6 months of life with only breast milk, and then start supplemental feeds with baby food at 4 or 6 months of life. If you are breastfeeding your baby, you could actually try to eliminate some foods in your diet that may be causing food sensitivity in your baby, and you can try them one at a time. Milk is one of the most common causes of food sensitivity in babies with moms that breastfeed, and so you can try to eliminate dairy from your diet for a couple of weeks and see if the colic improves. If it does, this will be a really good strategy for you. Make sure you're still getting enough calcium and vitamin D with supplements, but eliminate dairy while you're breastfeeding if it shows to decrease your baby's colic. Other foods that you should try to eliminate if dairy doesn't work are caffeine, onions, and cabbage. If your baby's formula fed, then you can ask your doctor about prescribing or just you buying over the counter a non-cow's milk based formula if possibly your baby's colic is due to a sensitivity to cow's milk. The brand names that are most familiar, but you could get one that a store brand just as well, are Enfamil Nutramigen. Enfamil is the brand, the name is Nutramigen, or Similac Alimentum. Again, with trying these formulas or making these changes in your diet, if you breastfeed, you should expect to see a decrease in the colic if that's the cause of the colic within a couple of weeks. If you don't see a change, then you can go back to eating milk yourself or eating the foods that you were eating before, or if you're formula feeding, of giving your child normal or your baby normal formula. Tip number 9 is to make sure that you take a break. Colic can be very frustrating for moms because it seems like everything you do doesn't work. You can get really tense and anxious, or even, I'm sorry, not just moms and dads, any family member taking care of the baby can get really tense and anxious because your baby just won't stop crying. It's really important not to let it get to you, to call a friend or family member and have them take care of your baby while you just get out of the house, take a walk, do something to relax yourself for an hour or two. And that'll help you keep a positive attitude and sort of see the bigger picture and not get frustrated or angry at your baby. And absolutely, whatever you do, don't shake your baby. This can lead to brain damage, can lead to vision problems, and can lead to death for your baby. And tip number 10 is to believe in yourself. Colic is very common. I've given you some helpful tips to reduce colic or treat colic in your baby and to know when your baby has colic. I hope these tips have been helpful. Thank you very much for listening and have a great day.